My name is Dr. Marwa Hassan. I am a functional medicine doctor. I help women with autoimmune disease learn how to lower their inflammation and optimize their wellness. Today, we are going to be talking about breast cancer diseases. Yes, diseases. It's not just one disease, but it's at least 8 different types of diseases. So, uh, when we speak about breast cancer, it's a whole different story depending on the type of the cells involved in the breast cancer, whether there are ductal cells or lobular cells. Now, the ductal cells also, it differs if they have already invaded the ducts or they're still inside the ducts and they didn't invade the ducts of the breast. So either we are talking about ductal carcinoma in situ or invasive ductal carcinoma. They're two completely different diseases. Now, if the cells involved are not the ductal cells, they are the lobular cells. This is called lobular carcinoma, invasive lobular carcinoma. Again, that's a completely different disease, age range, the way the cancer cells behave. Usually, it's more involved. It can come in the contralateral breast, involves both breasts. Sometimes it can be involved both breasts at the time of diagnosis. There are also rare kinds of pathologies like tubular and mucinous and epocrine and secretory. These kinds, different other kinds of cells, they are rare, considered 1% of breast cancers, but they also differ in the way they behave, the age they come in, and the treatment patients should receive. Now, when we discuss ductal and lobular, we have to look into the kind of receptors on the tumor cells. So, whether they have hormones, are they estrogen positive or negative, progesterone positive or negative, this completely changed the treatment that the patient will receive. Also, and a very important protein that we check for when patients get diagnosed with breast cancer, it's called the HER2 protein. It's a very important protein because it can change the treatment protocol. And the bad side of it, it's an invasive kind, but on the other hand side, there are now medications that target that protein and makes treatment more available and successful. And there is the kind of breast cancer that has everything negative. There's no hormones receptors and there is no HER2 protein receptor. That's called triple negative breast cancer. That comes in women with young age, has completely different risk factors than the other breast cancers, and the treatment would be completely different as these patients are not going to benefit from either hormone therapy or HER2 or Herceptin. Continue following us. We will be discussing the screening for breast cancer and other things involved that to increase the awareness of breast cancer. And remember that the change you want to see in the world is always inside you. Thank you.